A disability is something that has a major impact on your life.
Every disability is different.
And it's never the same thing for two people. I am blind in my right eye totally and partially sighted in my left eye.
I was 18 years old. We were traveling way too fast on a gravel road. Broke my neck, my back.
My Asperger's syndrome and my cerebral palsy.
I have anxiety and depression. People would have no idea just talking to me.
Being independent means different things to different people.
I want to live in my own house. I want to pay my own bills.
Live independently and not rely on other people.
When someone is not able to live as independently as they can, it does have a detrimental effect on people's physical and mental well-being.
It's no complicated thing. It's just that people with disabilities want to be included.
Plenty of people get stuck in ruts when they feel like they can't overcome something in their life. That's where LIFTT comes in.
Living independently for today and tomorrow. LIFTT. We help people of all ages and all types of disabilities find the resources or acquire the skills to live as independently as possible.
We serve the southeastern 18 counties here at the Billings office. We have a variety of things that we offer. We can help with grant funding for adaptive equipment.
Maybe a home modification so they're able to access their home. We help people to find that funding.
Helping people apply for Social Security benefits.
Medicaid, Medicare, housing.
They have a peer support group. Peer support, I think, is key.
Sharing life experiences is one of the most powerful things to help people who might be new to disability, who might be struggling with their disability.
Youth transitions is kids that are transitioning out of high school. They need to learn those adulting skills. It might be rent an apartment, learn how to grocery shop, budgeting.
Help someone advocate for themselves in a school or an employment setting. One of our biggest strengths is providing folks with information and referral. If we can't help you, we hope to know who can.
A lot of times we'll have a potential consumer call in and they think that they just have one need, and it turns out that we end up finding 3 or 4 things we can actually do for them.
You can just come in and say, hey, I feel like I have this going on. Can you help me? And we can, which is so cool to me. I love that.
Most of us on staff at LIFTT have identified ourselves as having one or more disabilities. That is helpful in many cases.
It's easier to empathize with someone when you yourself have struggled with a disability.
This is what we specialize in. This is who we are, and this is what we do.
And it costs nothing to go to LIFTT. It's a nonprofit organization and they're there to help.
Somebody that was a consumer that was working with LIFTT was asked to do an art project. He visualized that the balloon helps to lift people up. And then it became the logo, and it's stuck.
There's been success on all kinds of levels.
It's really rewarding to have a consumer go, hey, I was able to do this by myself today.
We want people to live their best life as independent as possible.
Live as everyone else in society and live as a part of society, not apart from society.
Everybody needs help. Sometimes you just need a little more help, and that's okay. That's absolutely okay.
There's plenty of life to live still, and there's a way you can do it. Keep chipping away at it, little by little by little.
Knowledge is power. Let's share it, for crying out loud.
Send us an email, give us a call. We'll do our best to help.
We can definitely help figure out what your needs are and get started on that. We're one of many steps in the path to independence, and we're happy to be serving people here in the community.
Good day and welcome to Living Well in Montana. Living Well in Montana is a program of living independently for today and tomorrow, or LIFT. LIFT is one of 4 centers for independent living in the state of Montana. We are a nonprofit source of information, resources, and advocacy for people of all types of disabilities at any age across our 18 county service area in southeast, south central Montana. For more information about LIFT, I encourage you to visit our website at lift.org, LIFTT.org, or download our mobile app for your Apple or Android devices. My name is John Robison. I am the Outreach Director, Community Health Worker Supervisor for the Billings office. With that said, I'd like to introduce 2 people, my special guests. The first one is Jen Hawkinson. She is the Regional Manager for the Glendive office. And then I have Miss Nancy Grigsby, who happens to be the Community Health Worker Supervisor for the Glendive office. So with that said, let's do this. So first thing, Nancy, I'm going to start off with you if you don't mind.
Okay.
If you don't mind, tell us a little bit about yourself and what you do at LIFT.
Well, I started at LIFT about 3 years ago as an independent living specialist. When I started there, I had come from working as a dorm aide at Home on the Range for girls and boys out of Sentinel Butte, North Dakota. And I've moved into the community health worker portion of LIFT just about a year ago.
Mm-hmm. Okay. So you do the community health worker, the independent living, okay?
Yeah.
And for the people in the audience who are not aware of the independent living specialists are the ones who help the consumers with stuff like Social Security, Medicaid, help establish the services that they need. Okay?
Yeah.
Now, let's go to the big one, why we're here. Community health worker. In your own words, tell me about what you do.
First, can I have Jen read what the definition of the community health worker is?
If you would like to. Jen, read along.
The community health worker is a frontline public health worker who is a trusted member of and/or has an unusually close understanding of community served. This trusting relationship enables the workers to serve as a liaison/link/intermediary between health/social services and the community to facilitate access to services and improve the quality and cultural competency of service delivery. A community health worker also builds individual and community capacity by increasing health knowledge and self-sufficiency through a range of activities such as outreach, community education, informal counseling, social support, and advocacy.
So I know that I think back to when I first started LIFT, when I became the first community health worker within the organization, for example. And I remember going through the community health worker course. Me coming from a military background, I never thought I would be doing the stuff as a community health worker, which I started doing. For example, medication checks. Go through, make sure that the medications that the consumers are taking are the medications that the doctors want them to take. Make sure that what they're taking is adequate according to the doctor's prescription. Make sure they're not taking expired medications, and hopefully encourage them to get the older medications out and turn it into disposal site.
Right.
And then also home safety checks, especially with our consumers who are a little older. I go in and I do the home safety visit. Make sure that the entranceways, hallways are clear of debris, clutter. Make sure in case emergency services have to get in there to take care of that consumer, just to ensure that they can get in there. Make sure there's not a whole bunch of garbage in the way.
Right.
And another thing that I started doing was checking, make sure their surge protectors are not overloaded, for the fire hazard. One of the situations that I revert back to is a consumer of mine who passed away within the last 8 months. An amazing lady. Her name was Sharon. Miss Sharon was 96 when I first met her. She was reclusive in her house. When I started working for her, she did not trust us. She didn't do anything. On my first walkthrough, she told me she was hungry. And I told her, go make something to eat. So I watched her when she went to the kitchen, put a pot on the stove, turned the heat up, and then walked away. Forgot that there was an empty pot on the stove on fire. So then I began working with her, and we started doing little 3x5 cards all throughout our house. You know, for example, on the door, there was a sign we put on there, is the stove off? You know what I mean? That she wrote in her own handwriting. And gradually, through the course of 6 months, she started getting up, she started getting moving. I had her walking up and down the block. It was so exciting to see her actually get up and move. Okay, and so those are some things that I instituted when I first came in.
Yeah.
Which obviously you got here after I did. You went through the course. What are some of the other services you do, or the other items you do for your consumers as a community health worker?
Well, going back to the definition, my definition of a community health worker, you know, there's the one that's out there for everybody to read online, what a community health worker is. I believe that in order to be efficient and do the job to the standard that I would hope people would do it, you need to get the relationship with those consumers first. A lot of people, especially the ones I work with, are elderly, and they don't really have a lot of faith in the people that are going to, if they're going to show up when they say they're going to show up, if they're going to be there. You know, they've been let down quite often.
have a great example of that. With
Sure.
So there was a gal that came into Glendive in October off a bus. She was kind of a gypsy. She moved from Maine, and she lived in every one of the 50 states at one point in her life.
She was a spicy little thing.
She was very, very spicy. When she came in October, she wasn't under the community health worker service right away, and I would hear her in the office being spicy, and I was thinking, oh, thank goodness she's not one of my consumers. I don't know if I could deal with this lady. And then in December, she was living in just a little rundown motel where it was her little apartment, and the dorm size refrigerator fell on her, and she ended up in the hospital.
Didn't it break like her hip or something?
Cracked her pelvis. She was in the hospital until January, and in January when she was released, then she became one of my consumers. And as the community health worker, I checked on her every day. I made sure that she was getting up and moving. She had some swelling, edema in her legs, and I was trying to show her ways to get her legs elevated and get the swelling down. There was a time when I went up into that room where she was at, and her legs were so swollen and red, and
like she was probably 80 pounds dripping wet.
Yep.
And her legs were like this big around. It was huge.
Oh, wow.
Yeah.
And I was telling her, I need to call the ambulance. I can't get you to the hospital, and you need to be checked. And she loved Jen, because Jen had worked with her first. So I snuck out and I called Jen and I said, you should just kind of show up here. Maybe you can help me convince Cheryl to go in. And Jen got there and said, oh my goodness, look at those legs. I think you really should go in to the hospital, go get that checked. And she looks at the little lady, Cheryl looks at me and she goes, you listen to her. After I had just been telling her. So it went on, and eventually she ended up, I spent that time up at the ER with her. She ended up in the ER a second time and then was admitted to the hospital. And I had promised her, I'm not going to let them keep you and I won't leave you alone.
Yeah.
And I spent that last week with her at the hospital and was able to advocate, when they weren't telling Cheryl, we're going to move your leg, it's going to hurt for a minute. They just do the stuff. I was able to advocate and say, if you approach this differently, she's not going to scream and it's not going to be so traumatic. So I stayed there with her, and that's going to get me emotional, but I was there with her and I held her hand until she passed away. Oh, no. And she didn't have to be alone.
Yeah.
So
Well, that's
those
good.
are the kind of things that I love about the job, is those people that don't have anybody
So
And-
essentially, you did kind of like a doula service when you were there.
Absolutely. The death
Yeah.
doula thing, yeah.
Yeah, that's actually amazing. This is the first time I'm hearing about that, and that's
I miss her every day.
I know. You were so
Just-
nervous at the beginning, and I'm
Yeah.
like, get used to her, you're going to love her.
Yeah.
And then, yeah.
That's one thing. Just like it's different with the independent living specialist consumers. One thing I like about the community health worker consumers is I hate to say it, but I get attached.
Yep.
Like my little Miss Sharon, I love the old lady. You know what I mean?
And you can develop that relationship
Yes.
that you don't really develop as much with the independent living specialist
Yep.
because you're with
You're also
them
spending more
time.
time with them.
So I've noticed, like for example, since I primarily work with a lot of veterans, my consumers I have 4 elderly veterans that I'm a community health worker for, and I've noticed that number one thing that helps them out is talking, getting familiar with them, their past, what they went through, and seeing them open up to somebody is amazing. The first time you talk to them, they're kind of like standoffish.
Oh yeah.
But once you kind of mention, hey, listen, I've got 8 deployments underneath my belt, not in the environment you did, but totally different, but still the same, it opens up that doorway. So I love that part of it.
Yeah.
And it gets them open up, and it's that bridge. It breaks down the barriers talking to them, which I like.
Yeah.
You also have that other consumer that is she was very standoffish at first.
Yeah.
And now she's,
You realize after working in this position for a while that mental health isn't just an issue for younger generations. It is an issue that is throughout the generations. And dealing with anxiety and depression myself, I have a consumer that has extreme anxiety and depression and some bipolar issues. And when I first started going there, that was a real standoffish, what are you doing here? Why? And now if I don't talk to her every day, you can totally tell she starts to panic that person that she's finally able to trust.
Yeah.
She worries that I'm not going to be there the next time or
right.
something.
And you've helped her to
But,
advocate too.
Yeah, I've gone to doctor's appointments with her where she was just really struggling with all of those things, her diabetes not being right and whatever. And so I was able to get the list of her medications from her doctor, and I could take them back to her house with her, and we could go through and make sure that she had the right medications, the right doses, that they weren't expired. And I could answer some of the questions that she had asked the doctor because I was there taking notes for.
One of the most important things I noticed that working with some of my consumers, and it might be the same for you, is I like attending, obviously if they approve with the consumer, I like going to the doctor's appointments with them because my elderly folks that I work with, they, a lot of times afterwards, they're like, well, he said that, he said this. And I'm like, no, man, he didn't say that, he didn't say this. So I make those, like I said, I make a little checklist, 3x5 cards for them, especially when it deals with their medications.
Yeah.
Because sometimes you have to. And also, I got to make sure, I like making sure that the intent of the doctor is understood by the consumer.
Yeah.
And a lot of times I'll type up a little thing on the computer in bold lettering, I'll hang up with them that says the list of everything the doctor says they have to do throughout the day.
Right.
Okay, good. I like it.
I know, Nance, you've gone to doctor's appointments and been able to talk to the doctor and say, hey, remember we talked about this last week. You had a concern about this.
Yep.
Yeah.
So you help to advocate in that
Yeah.
way as well.
Yep,
Yeah.
that's huge. And soon, here very soon, once we open up this new grant with the Center of Excellence, the Community Care Hub, we're going to be more integrated in with the local physicians so that way it's easier for us to do that. We're putting together a program where we will work with, like here in Billings, I'll be working at Riverstone Health, Billings Clinic, some of the mom and pop doctors' offices, to make sure they understand, because there's a lot of stigma about community health workers and what we do. Now, I know, for example, going to myself and the network community health workers here in Billings, when we go to doctors and we go to those nurses, a lot of times they are like, why are you here? What are you doing? So we explain to them, you know, what a community health worker is, what it does. Sometimes we get a little bit of resistance, but it's getting better now, finally, thank God.
Yeah.
Is it seem to be getting better over there on your side of the woods as well? Or is it some of the same?
I think for the most part, I've had pretty good experiences with the doctors and the nursing staff.
You just got a bunch of
especially-
referrals from the vets home.
Yeah, I just got 3 new referrals from the vets home, and a lot of people, they didn't even realize that LIFTT existed in Glendive, much less the community health worker service and the things that we can do for them. So,
We just got to keep in mind that the platform of the community health worker officially has only been around for the last 2.5 years. Before that was community navigator. Before then it was something else. So it's newer terms, but it'll get around.
Yeah.
I got a crazy question for you. Is there a fee associated with the consumers using your services as community health worker? Do they have to pay anything?
no, there's no fees attached at all. They can, it's easy as coming in and saying, hey, I have some anxiety and I need some help. Can you assist me in any way? And they sign up for LIFTT services. There is no fee.
Okay. And so, Miss Jen, I've been asking her a lot of questions, and I got a big question for you. You, as the Glendive Regional Director, the boss lady, what are your expectations for the community health workers under your leadership?
So Nancy's doing a great job of getting our name out in the community and helping our seniors. I think there's a big gap where those services need to be filled in, and she's doing a great job. It's almost like an assisted living kind of. It's Grandview in Glendive, and I know she goes up and helps a couple people there, and that opened the door for me to be able to go talk to the director about LIFTT services in general, and he is overjoyed at what we do. And actually, before I left last time, he's like, I said, let me know if there's anything. He goes, no, you let me know if there's anything you need. And I was like, okay, thanks.
That's good.
Yeah.
I like that. So one thing that amazes me about this program is finding the right people to work as a community health worker. Something I see across the board is first you have to find that person who has what I call give the darn factor, that cares, because you got to care about the consumers. And then next thing is people who don't mind being there when bad thing happens, like you with your example, people who could actually fall through and be there with them, as they pass away, which is amazing. So I've essentially got one other question here for you. And that is, let's talk about the elderly consumers. I know that unfortunately there's a lot of consumers who are elderly, who sit on the couch, watch TV, don't like doing it much. What is the importance of them getting up, getting moving, and getting active?
I think it's very important for them to stay active and move around. So, there's a couple of them that I go and visit with, and I'll suggest, hey, let's go have some coffee. Say, for instance, up at Grandview, the one of the gals I work with there, we always call it, we're going to go down for coffee. She comes out of her apartment, and we use her walker and walk down and have coffee together, work on a puzzle, visit, and walk back. When the weather's nicer, we can go outside and walk around the area outside. But to keep their strength and their risks of falls are less if they stay active. So
We have our guy at the vet's home too that likes to go outside and doesn't
loves to
really
go
get
outside.
that. He doesn't get that opportunity because the vet's home is so short-staffed. So Nancy being able to go out, or our other gal, if Nancy's got a lot on her plate, they kind of tag team. And he was one that I had referred to you.
Yeah.
And I went out, he's another one that's pretty spicy. And
I get a lot of the spicy ones.
I like the spicy ones. They keep it interesting. But yeah, it's kind of fun to watch those relationships develop.
Yeah.
And I know quite a few referrals have come from us if we can identify when we're doing the IL side of it. There's a gentleman that years ago when I worked at LIFTT, I helped him and his wife. His wife had like kidney disease and like 10 things going on, and we helped her to apply for Social Security. She was denied, which was really a bummer, but whenever I would see them out in the community, it was always, oh, hi, how you doing? You know, so sweet. And he was one that came to mind because his wife has since passed. And you go see him. How often do you see him?
I see him once a week, and he says every time he's just to have somebody to come in. He looks forward to the visit, and yeah.
Just the sweetest guy, too.
Very sweet guy.
Yeah.
Okay. And so we're going to start wrapping this up here in a second. So obviously we know this, like with any of LIFT services, there's no fee for absolutely anything. There's no age constraints. One of my community health worker clients or consumers, is 9 years old. Okay. So just for the general audience, if you have a person that needs services, need somebody, go and check on them. Give us a phone call. Yeah. And we definitely help them out.
Can I say what defines a disability for us is anything that has a major impact on your life, but you don't have to have a diagnosis.
There you go.
Yeah. So you can literally walk in and go, I think I have anxiety. Great, you're qualified. Yeah. So I think that deters some people when they hear disabilities, but once they figure out the definition, it's definitely a more, oh, okay, yeah.
Okay. So do you ladies have any additional comments, anything else you want the viewers to know about before we wrap this up?
I know our office alone covers 10 counties, and Nance has a ton of consumers in Glendive right now.
Yeah.
So we actually have somebody else that's training that's going to be doing those outlying counties.
Yeah.
So
pretty booked up in Glendive. I think I have 14 consumers. So.
I understand. I'm pretty booked up as well. So, okay, well, that's good. So for our audience, this brings us to the end of the program. Once again, I'd like to thank you for watching. Thank you to our guests, Ms. Nancy and Ms. Jen. And thank you most of all for Channel 7 for allowing this information to be shared to our viewers. With that said, more information, please go to www.lift.org. And if you need any assistance whatsoever, especially any assistance whatsoever, please reach out and let us know. Thank you very much. Have a great day.